We have a CT of the abdomen. It's a female patient. Let's see what's up. Why we are. This patient has 2 CT scans, one from 1 week ago, and another one from one from 1 week ago and one from 1 week prior to that. So that, let's download both of them. It's some sort of advanced cancer patient, and they probably did an enhanced CT scan. So this is quite possibly a useless scan, just one of those make-believe scans that the doctors ordered to have anything to say to the family when they can't do much. Because if you are staging a cancer patient, it makes no sense to do an unenhanced scan, because you won't be able to stage anything. It just doesn't work. So this is from November, the 11th of November. It says she has ovary cancer and she is 57 years old. So let's look for, there is a small gastric herniation. They went almost all the way through the chest. Why? I don't know. Go figure. Yes, there is some huge heterogeneous mass on the pelvis. It mixes up with colon, gets mixed up with colon, the uterus, maybe the ovaries. I don't know what this is, because there is no contrast enhancement, and I'm really not going to waste time trying to guess. This isn't the kind of guesswork I enjoy practicing. So just going to describe it as a huge mass on the pelvis. There is some free fluid, so a small ascites and some calcifications, and colon is right there, rectum is right there, and some aortic calcifications, gallbladder, pancreas, and spleen, and whatnot. So just that same old crap when people don't care enough to do a proper scan. They do whatever they please, and they send over for report, and we sent back to them as much information as we can probably guess, because we can't really be sure of anything in such horrible scanning conditions. So this is an older scan. The gallbladder was closed up, was contracted, was reduced in volume. There is the same mass right there. Bladder was yet again reduced, partially filled up. There was the same free fluid on the pelvic cavity. This right there, this is free fluid. So a small ascites, and there are clear signs of constipation. Of course, because there is a huge pelvic mass, it's supposed to be very difficult to defecate. Clear signs of ascites right there. And it's quite the same exam. Can't really say much difference. There is much difference between the two. Just a couple of useless abdominal CT scans that help no one but the hospital make a bunch of money. So let's just report one of those scans and we just copy and paste to the other because it's really just the same. Besides the gallbladder is voided, it's partially voided on the old scan. Just going to put a phrase at the top of the report saying it's really difficult to evaluate the images because there is no contrast enhancement. Because if this patient turns up to have a full-blown hepatic metastasis and all over the place, as soon as you inject contrast and we are able to see all kinds of secondary disease, they are going to mention that the previous CT scans were all normal and those metastases aren't supposed to be so big and so severe if the last scan was apparently normal. So I have to make clear on my report that this scan isn't enough to do a proper cancer staging on this patient because there is no contrast enhancement whatsoever. So it won't help much, but it's just what I can do for the time being. And I could just sip some coffee and curse in my head as I report this piece of crap. And this is it. Just going to report that huge mess on the pelvis. Not going to just 10.6 to